Okay, we'll start with a brief revision. It's been a long time, probably 2 weeks, 1 or 2 weeks since we have seen the last lecture. So we'll start with a brief discussion on PNF, the introduction part. We'll see the basic principles that we had discussed, and then we'll move forward. Yeah. So first, the name PNF stands for proprioceptive neuromuscular facilitation. Yes, it was given by Herman Kabar and Margaret Knott in 1940s. Later on, Dorothy Voss joined the team in 53 and continued to expand the treatment procedure. In the end, in 1956, that is after 3 years, Margaret and Dorothy wrote the first PNF book that was published. Yes. Proprioceptive means having to do with any of the sensory receptors that give information concerning movement and position of the body. I have given you this example. Even right now, when you are sitting in a specific position, your brain is continuously aware of all the joints. How is that possible? Through the sense of proprioception. એક એવી સેન્સ જેનાથી આખા બોડીના જોઇન્ટ્સ કઈ પોઝિશનમાં છે at a point in the time, that is termed as proprioception. That sense is termed as proprioception. Second, neuromuscular, that is the nerves and the muscles. And third is facilitation, that is making it easier, or to facilitate, that is to encourage it. Yes, જે આપણે જોઈ છે એવું કરાવવા માટે, that is facilitation, that is making it easier. So PNF, that is proprioceptive and sensory mechanism, feed information to the nervous system. So first thing, આપણે proprioception through nerves and muscle ને stimulate કરી છી અને એની પાસેથી response લઈ છી. Now this response can be of 3 types. એના 3 type છે. આપણે કેવો response જોઈએ છે એના ઉપર આપણે આગળ વસ્તુ કરશું. So first, contraction for strengthening. તો muscle weak છે એને contraction કરાવવાની વધશે. Second, relaxation for stretching. PNF stretching, one of the types of stretching that we have discussed is, and we are going to see it again in detail, that is relaxation after stretching. And third, improved balance and equilibrium. Balance and equilibrium improve karva mate. Balance is nothing but an ability of an individual to maintain center of gravity in a given base of support. Yes, right now I am sitting down at this position. If I am able to maintain my center of gravity within the base of support formed by the seat, I will not fall. Yes, that is termed as balance. If you are lying down, your center of gravity is around the L5 S1 level, and this is maintained in the body position. So that is again you are in the balanced position. Basic neurophysiology. Yes, we have discussed all of this, so we'll go through it rapidly. So first is after discharge, that is effect of stimulus continues even after stimulus stops. Stimulus stop થઈ ગયું તો પણ એનો response ચાલુ. Yes, say for example you are encountering an accident. The accident has happened, but still after a day or so you will have pains. That is also termed as after discharge. If the strength and duration of the stimulus increases, after discharge also increases. Yes, if the strength of the stimulus, yes, if your bone is broken, yes, each accident ma jo tamaru koi pan bone fracture thai, that means there are higher chances that pain will last for many days. Yes, ખાલી તમને સ્કિન માં લાગે અને તમને બોન માં લાગે, so that is intensity, strength. Duration, for more amount of time your hand was stuck somewhere. Yes, say for example in a machine also it was stuck for 10-15 minutes, compare it to 1 second. Yes, so the duration also of the stimulus changes the response. So after discharge, if the strength and duration is increased, after discharge also increases. Second, temporal summation. Summation means addition, sum means addition, temporal related to time. Successive of weak stimuli, sub-maximal, occurring within short period of time, combined to cause excitation. કોઈ પણ action potential generate કરવા માટે you need threshold, more than threshold stimuli. પણ જો તમારી પાસે સબ મેક્સિમલ ઓર સબ થ્રેશોલ્ડ એટલે કે થ્રેશોલ્ડ લેવલ કરતા ઓછું સ્ટિમ્યુલાઈ હોય એવું તમે બે કે ત્રણ સ્ટિમ્યુલાઈ એક સાથે આપો એક જ ટાઈમ ઉપર yes or within given short period of time એક બે સેકન્ડ ની અંદર then there are chances it will produce a effect. Yes, that is temporal summation. Coming to spatial, that is related to space, jagya. Weak stimuli applied simultaneously to different areas of body reinforce or summate each other to cause excitation. Yes, giving two stimuli sub threshold એટલે કે excite કરી શકે એનાથી ઓછા લેવલના stimuli પણ બંને અલગ અલગ sorry same જગ્યા ઉપર બે અલગ અલગ stimuli at the same time, that will also give a summation effect and there will be a reaction, that is will be a response. Irradiation, spreading and increasing the strength of response when either the number of stimuli or the strength of stimuli is increased. So whenever you ask an individual to lift heavy weight, yes, first there will be recruitment of only fingers, then wrist, then elbow flexors, then shoulder flexors, and then the back muscles. Yes, simultaneously this keeps on going on. Yes, so this is termed as irradiation. So if you are providing a very high stimuli and you are giving or you are expecting a response from larger muscle group, it will happen through the irradiation. Coming to successive induction. Successive induction tells an increased excitation of agonist muscle follows stimulation of antagonist. Technique involved reversal use this property. So increased excitation of agonist muscle follows stimulation or contraction of antagonist. So once you have done biceps contraction, at that time your triceps should be relaxed, but after biceps forceful contraction, biceps will relax and triceps will contract. This is termed as successive induction. Successive, one after the other. Induction means caused. એકના લીધે બીજામાં contraction આવે, that is termed as successive induction. And reciprocal innervation, yes, when biceps is contracting, triceps has to relax. So contraction of muscle accompanied by simultaneous inhibition of their antagonist. So biceps is agonist, triceps is antagonist. So biceps is contracting, triceps will be antagonist, which will be inhibited. That is more of reciprocal innervation. So work of Sir Charles Sherrington was important in developing the techniques of PNF. Relaxation techniques, if we are going to see contract and relax and hold and relax, we'll use these techniques. Coming to basic procedures. Okay, just a second. Okay, so sorry for that interruption. Yeah, okay, so now we are coming to basic procedures or basic principles that we are going to use in PNF. PNF માં કયા basic principles આપણે use કરશું? These are the 10 things that we will learn and that we will apply to give proper PNF techniques. There are three important terms First is principles, second is pattern, and third is technique. Yes, PNF ની અંદર આ ત્રણ વસ્તુ આવડવી જ જોઈએ. First is principle, second is patterns of PNF, and third is techniques of PNF. Principles use કરીને આપણે techniques બનાવશું, and there are predetermined patterns of PNF. Yes, do not go in detail, we'll be learning the same when we are taking the lecture. So first is the basic procedures or basic principles of PNF. So when it asked in exam, or when I ask you even practically, you have to tell me about the basic principles is the same as basic procedures. Yes, what we discussed last was basic neurophysiology. Yes, that was neurophysiology, something that you have learned in first and second semester. That was nothing new. Now these things are new. You have to know how to do this, then only you can apply it and give proper treatment through PNF, proprioceptive neuromuscular facilitation. So coming to the first, that is resistance. What is resistance? Can someone tell me? Resistance એટલે શું? What is resistance? You can unmute yourself and let me know or write in the chat.
Obstruction given during a movement, performing a movement.
Okay. Instead of obstruction, I would say it is a force. Yes, it is a force given to oppose something. Resistance એટલે oppose કરું. Yes, I am taking lecture. You don't want me to take lecture. You will oppose. So that is also termed as resistance. Yes, a patient is doing some movement and you oppose that. Any સામે તમે જોર કરો, that is also termed as resistance. So here we are talking about physical resistance, something that a therapist will apply to produce a movement or to resist or to oppose a movement. The amount of resistance provided during an activity must be correct for the patient's condition and the goal of the activity. This is called as optimal resistance. Say for example, the patient is able to take, okay, let me just join in with, so I'll be able to demonstrate you more easily. Okay, I hope I'll be clear, and yeah, okay. Okay, fine. So the amount of resistance provided during an activity must be correct for the patient's condition and the goal for the activity. Say for example, you want to provide resistance. Yes, the amount of resistance that you provide to a normal person, compare it to a person who is athlete. કોઈ રોજ 10 kgs થી biceps curl કરતું હોય, અને say for example me, I am not doing any exercise right now. So આ બંનેમાં તમે same resistance નહીં આપો. Yes, it will depend on patient's capacity. Patient માં કેટલી capacity છે એ પ્રમાણે તમે resistance આપશો. તો that is termed as optimal resistance. Now this we talked about normal and someone who is going to gym. Also we have to compare it to normal and the person who is sick. Yes, જેને બીમારી છે, say for example muscle એના weak છે, say for example hemiplegia છે, જેને muscle tone સાવ ઓછું છે, paralysis છે, muscle tone છે જ નહીં, તો એમાં resistance આપવાનું નહીં આપવાનું. તો એમાં શું કરવાના? બીજા principles use કરવાના. Yes, so first is resistance. In resistance the word optimal resistance is to be used. Optimal resistance એટલે the resistance which an individual should be given on his terms. એ કરી શકે એટલું જ એની સામે રેઝિસ્ટન્સ આપવું. યસ, આઇસોમેટ્રિક કોન્ટ્રાક્શન નથી કરાવવા. Yes, we want to do isotonic, but we want to provide resistance. There are four main types of exercises: active, passive, active assisted, and resisted. Yes, four main types of exercise that you might have learned in first, second semester, exercise therapy 1 and 2. So this fourth type of exercise, that is resisted exercise, something that you are going to learn even in MMT and all these things. Yes, in the first part of exercise therapy 4. Same thing, resistance will be using and will provide optimal resistance. એટલે કે patient કરી શકે એટલું જ resistance provide કરશું અને સામે will ask the patient to perform. Yes, so that is the first thing in resistance, basic principle. Amount of resistance provided during an activity must be correct for the patient's condition and the goal of the activity. Also, it depends on the goal of the activity. Say, for example, the patient, uh, we want to facilitate isometric contraction કરાવવું હોય ત્યારે શું કરશું? Optimal resistance શું થશે? Maximum resistance that you can provide as a therapist to the patient. Yes, so say for example, I am resisting just the elbow flexor. So I will resist as much as I can and ask the patient to perform. Yes, so that is one. If I want to perform activity, what will I do? I'll provide resistance. First, I'll check how much the patient is able to do. Then I'll provide resistance only as much. That is something subjective. તમારે જાતે કરવું પડે. તમારા જ હાથને તમે, you can perform it this way. Take your one hand, right now do it if you can. Yes, take your one hand, try to resist near the wrist. Yes, and try to do elbow flexion of the resisting hand. Say for example, this is my right hand. I am using my left hand to resist. I am resisting my left hand with right hand. I am moving it into flexion. Yes, but I am allowing to resistance એટલું જ આપું છું કે movement possible થાય. Yes, I am only giving resistance as much as there is movement. Yes, I can also provide resistance for isometric contraction. એટલું resistance આપું કે right hand વળી જ નહીં શકે. Both are possible. Yes, if both you are doing, that means you understand when how much resistance to provide. તમારા left hand ને ખબર પડે છે કેટલું resistance provide કરવું. This is very subjective. આ તમે તમારા ઉપર કર્યું. જ્યારે પેશન્ટ આવશે એના ઉપર તમારે ફીલ કરીને કરવું પડશે. પહેલા you will have to test કે કેટલું resistance patient લઈ શકે છે, and accordingly you will have to provide resistance. That will be termed as optimal resistance. Optimal બધા માટે અલગ હશે, એક નહીં હોય. યસ, તમારા માટે આઇસોમેટ્રિક કરાવવા માટે 100 ન્યૂટન ફોર્સ જોઈએ છે, એથ્લેટ કો હશે ને 500 ન્યૂટન પણ જોતું હોય. અને for an individual who is say for example paralyzed, એમાં 10 ન્યૂટન થી પણ એને રેઝિસ્ટન્સ મળતું હોય. Yes, so optimal resistance will change according to the patient's condition and what you want to do. Isometric contraction કરાવવું છે or you want to do isotonic contraction, that is resisted exercise. Yes, so that is goal of the activity and patient's condition. બંને ચીજ ઉપર optimal resistance depend કરશે. That is the first basic principle. Resistance is used in the treatment to facilitate the ability of the muscles to contract. Resistance શું કામ provide કરીએ આપણે? If I am able to do biceps curl with 2 kg, why will I go for 3 kg? To improve my strength. The same thing, when we are providing resistance, pathologically, because of any change in the body, because of any pathology in the body, may that be in the nervous system, may that be in the muscles, may that be in the nerves, એના લીધે જે muscles weak થઈ ગયા છે એને આપણે પાછું strengthen કરવા છે, muscles ને coordinate કરવા છે, strengthen કરવા છે, એની માટે આપણે provide કરી છે resistance. Second, increase motor control. Motor related to muscles અને control, muscles ના ઉપર control લાવવા માટે. When there is paralysis because of only one thing. Paralysis is always because of what we know as stroke, brain stroke, or you can say brain attack. જેમ heart attack આવે ને, same thing brain attack થાય. શું થશે? blood જે પહોંચવું જોઈએ normal brain ને through internal carotids and vertebral arteries એ brain સુધી નહીં પહોંચે. brain સુધી નહીં પહોંચે તો શું થશે? brain ના function stop થઈ જશે and there will be one half of the body paralyzed. Yes, because of this paralysis muscles weak થઈ ગયા. Yes, muscles માં વાંધો છે? નથી. વાંધો ક્યાં છે? brain માં છે. They are not able to control the one part of the body, one half of the body brain is not able to control. So that is termed as motor control. Brain is not able to control the muscles, motor control. Yes, so to initiate it or to allow faster recovery we provide PNF, that is resistance. Third, help the patient gain an awareness of motion and its direction. PNF pattern આપણે જોશું, એમાં there are oblique patterns. Say for example, I start from this position, my shoulder is in flexion, abduction, external rotation. Yes, and I will go downwards, opposite, and opposite. You see here, shoulder, this is flexion, this is abduction, this is external rotation. Yes, elbow extension, you can see my wrist into extension, complete extension. Yes, now I'll do complete opposite of it. એટલે shoulder થી start કરીએ તો I'll have to do extension, adduction, internal rotation of the shoulder. Then I'll be performing, you can see elbow flexion, wrist and fingers flexion. Yes, you might have seen this type of picturization in movies and everywhere. Whenever there is stroke, the patient is this way. Yes, this is one of the PNF pattern.
આ એક PNF પેટર્ન છે. આને ઓપન કરવું હોય તો એનું ઓપોઝિટ કરવાનું. શું કરવાનું? shoulder flexion, abduction, external rotation, elbow extension, wrist and fingers extension. Yes, એનું આ opposite કરે છે. Yes, this is opposite. Yeah. So this is one of the pattern. Remember the word pattern of PNF, which we are talking in the principles. First principle resistance. એની અંદર આ pattern ની વાત કરી આપણે. તો જ્યારે પણ what we will do, we will provide resistance so that the patient knows કઈ direction માં એને હાથ લઈ જવાનો છે. This is diagonal pattern. I am doing it rapidly. Yes, this is what I am doing rapidly. આ એક diagonal pattern છે. Yes. If I want to know, આ તો મને ખબર છે, I am a therapist, you will be therapist. Patient ને નથી ખબર કઈ રીતે કઈ movement કરવાની છે, તો તમારું resistance એને direction આપશે. Say for example, patient અહીંયાથી પાછળ લઈ જાય હાથ, તો your hands will be as such, they will provide resistance અને એ બાજુ નહીં જવા દે. Yes, એ આ જ પેટર્ન માં જવા જોઈએ. There will be no additional movements. So your resistance will guide the patient. તમારું resistance patient ને ખબર પાડશે કે કયા direction માં જવાનું છે. They will make it aware of the motion. And last, increase strength, that is the same to facilitate the ability of the muscles to contract. That is the same thing. Just a second. Okay. So that was about resistance. That is the first basic principle. Resistance to શું કરી શકાય? Strength improve કરી શકાય. Motion aware કરી શકાય. Motor control increase કરી શકાય. That is the main three aims of resistance. Facilitate the ability of the muscle to contract and increasing strength are same. Is everyone aware about the Oxford scale? Oxford scale of MMT. Does everyone know? Yes or no? You can write in the chat, yes or no, everyone. Reply. બધાને ઓક્સફોર્ડ સ્કેલ ઓફ MMT ખબર છે? Yes or no? If you are telling no, I'll explain. I'm not going to ask you anything. If you know, please write in the chat yes. If you don't know, write in the chat no. ખ્યાલ છે ઓક્સફોર્ડ સ્કેલ? Low repetition, high resistance technique. Okay, what is MMT? Can anyone tell me the full form of MMT?
Manual muscle testing.
Manual muscle testing. Why do we do MMT? MMT કરવાની શું જરૂર છે? What is the purpose of doing MMT?
Checking muscle strength.
Checking motor strength. Very true. Motor strength means muscle strength. When you want to check if a muscle is normal or not, at that time you go for MMT or manual muscle testing. For MMT there are specific grades. These are termed as Oxford scale. Oxford scale of MMT, manual muscle testing. Yes, એમાં 6 grades છે, 0 to 5. 0, 1, 2, 3, 4, 5. Total 6 grades. Yes, 0 means no contraction. એક પણ જાતનો કોઈ contraction muscle કરી શકે નહીં. Even when you palpate, there will be no contraction. That is complete paralysis. Grade 1, 0, no contraction. Grade 1, flicker contraction. Means you can just palpate that the muscle is trying to contract but it is not able to produce any movement. કોઈ movement produce નથી થતી, or slight amount of movement and only flicker of contraction of the tendons. Grade 2, yes, the third grade, that is grade 2. That means the patient is able to do the motion in complete range of motion but in gravity eliminated position only. Say for example biceps. Biceps muscle is doing this movement against gravity. Possible નથી in grade 2. But if you keep it this way, there is no gravity acting on the elbow joint. Yes, there is no activity of gravity on the joint, and that is why the patient will be able to do. Yes, so this is grade 2. Grade 3. Grade 3 means the patient is able to do against gravity. Against gravity means this is the movement against gravity. Yes, biceps against gravity. I hope I am clear to you. Yeah. Grade 4. Grade 4 means you are doing the movement and you are trying to oppose the movement, that you are providing resistance. That is not maximal resistance, you can say moderate resistance. Yes, so you provide resistance here, you keep the hand and you try to resist it. This is grade 4. And grade 5 is maximal resistance. Maximal as in maximum amount of resistance you can provide. Maximum amount of resistance, not your therapist no maximum amount nahi. Compare it to the normal side. If I am testing my left side, right side is considered to be normal. Yes, so first you will do MFT of the right side. એમાં ચેક કરવાનું કેટલી સ્ટ્રેન્થ છે, then you go and check for left side. જેટલું 5 grade આને કન્સિડર કરીને આપણે આપી છીએ એટલું જ આ સાઈડ આપવાનું. So if a patient, why am I discussing right now? Because we are providing resistance in MMT. Yes, grade 4, grade 5, we are providing resistance in MMT. So at this time, it is important that you understand grade 0, 1 and 2. Grade 0, જ્યારે contraction થતું જ નથી, muscle completely paralyzed છે, ત્યારે જો તમારે સ્ટાર્ટ કરવું હોય muscle contraction, that is or moving from grade 1 flicker contraction to gravity eliminated complete range of motion grade 2, there also you incorporate resistance. Yes, at that time you provide the resistance. So facilitate the ability of the muscle to contract. Muscle contract જ નથી થતું or flicker of contraction થાય છે, એમાંથી grade 2, 3, 4, 5 ઉપર જવું હોય MMT ના, ત્યારે you are providing resistance. So this is the first principle. What is the effect? Most effective proprioceptive facilitation, one of the basic principle and most effective in PNF. Increases the response of synergistic muscle, at the same time joint and associated synergist at the neighboring joint. So synergist, what are synergists? Can anyone tell me which are the what are synergists? You can give just an example, that is also fine. What is synergist?
Which support agonist.
Which support agonist, very true. So you can say while doing elbow flexion, જ્યારે હું elbow flexion કરું છું, at that time biceps muscle, that is the main agonist. એની સાથે coracobrachialis as well as you can say biceps brachii ના બંને head, and also with that other muscles brachioradialis, yes, or other muscles which are located in the anterior portion of the arm, they will be acting as synergist. Along with biceps, they will be contracting along with it to maintain that contraction. Yes, so E activate થશે when you are providing resistance. Bicep brachii ની level કેટલી છે? Say for example 50 newton હું force apply કરું ને તો જ કામ કરી શકું. 60 apply કરું ને તો coracobrachialis activate થશે. એનથી વધારે apply કરીશું resistance તો brachioradialis activate થશે, brachii activate થશે, and so on it goes on. Yes, so synergistic muscle activate થશે. Synergistic muscle activate થઈ ગયા તો પણ movement possible નથી, તો શું થશે? Irradiation. Yes, you are providing so large resistance that આ muscles તો બધા contract થઈ જ ગયા, agonist અને synergist તો થઈ જ ગયા, સાથે shoulder muscles or adjacent joints ના elbow flexors ની સાથે wrist flexors અને shoulder flexors ઈ પણ સાથે સાથે contract થવા માંડશે. Yes, and the hand will move into other way. Yes, so that is also one of the good things. So say for example patient ને wrist movements possible છે પણ elbow movements possible નથી. The elbow movements, that is elbow flexors are paralyzed, completely paralyzed. તો શું કરવાનું? wrist માં એટલો resistance આપવાનું, isometric contraction થાય એના કરતા પણ વધારે resistance આપવાનું. તો શું થશે? It will slowly and steadily, the force of stimuli will start initiating contraction from the biceps muscle, and slowly and steadily it will go for contraction of biceps or elbow flexors. Yes, so this is the basic principle of resistance using neurophysiology irradiation. So increase the response of synergistic muscle at the same joint, synergistic muscle at the same joint. Yes, like example coracobrachialis or brachioradialis along with biceps brachii, and at the associated synergies at the adjacent joint or neighboring joint. Neighboring joint માં કયા હતા? muscle wrist flexor, shoulder flexors. Yes, so they all will get activated. Facilitation can spread proximally or distally. Now here if we talk about હું એટલો force apply કરું elbow માટે, એટલો force apply કરું તો wrist પણ flexion માં જશે as well as shoulder will go. So it can move distally also, it can move proximally also. Both are possible. Antagonist is inhibited. Why? Reciprocal inhibition. Yes, જ્યારે biceps contract થતું હોય triceps ને relax થવું જ પડે. So antagonist inhibit થઈ જશે. Intense activity of agonist stimulates activity of antagonist group as well as co-contraction. Now, if you are providing resistance that does not allow any movement, isometric contraction ત્યારે તમે કરાવો છો, at that time there is something termed as co-contraction. Co-contraction means synergist as agonist as well as antagonist બંને એકસાથે contract થશે. If I am contracting this right now, my biceps as well as triceps are contracting. Because of this co-contraction, there is no movement produced. હું કોઈ પણ movement જોઈ નથી શકતો. Yes, you cannot see any movement at the elbow. Why? Because both are contracting simultaneously. બંને muscles simultaneously contract થાય છે. But to maintain any position, say for example I am holding it here. Yes, to hold this I need co-contraction. Biceps and triceps બંને હમણાં tension માં હશે. શું કામ? They want to maintain the same position at elbow. Say for example 90 degree of elbow flexion. Yes, if co-contraction is not there, શું થશે? Biceps વધારે contract કરશે તો hand will keep moving into flexion. And once it is in flexion, I may even drop this bottle. Yes, so that is advantage of co-contraction, to maintain a simple position of the joint. એક કોઈ પણ contracted position of the joint maintain કરવું હોય, at that time co-contraction is needed, and through resistance you can provide it. Second, irradiation reinforcement. We have seen resistance. Yes, that was the first principle. Coming to irradiation. Irradiation is spread of the response to stimulation, that is called irradiation. And reinforcement means to strengthen by fresh addition and to make it stronger. Yes, irradiation and reinforcement. Irradiation means તમે stimulus એવું provide stimulus એટલું high હોય છે કે ઈ spread થવા માંડે. Yes, and reinforcement means to give a new stimulus itself. Yes, say for example, irradiation means you can say 5 soldiers are fighting in a field. Yes, 5 muscles are being recruited by the nerve. Same thing. Yeah, same example, just compare it. 5 soldiers are fighting in a field. Ek field ma, ek war ma 5 soldiers are fighting, and they encourage each other to fight more and more. That is termed as irradiation. એક મોટિવેટ કરશે, એમાંથી બીજું વધારે ફાયર થશે, એમાંથી ત્રીજું, એમાંથી ચોથું અને એમાંથી પાંચમું. They will get motivated and they will fight better. That is એક muscle fiber activate થશે, એ એટલું activate થશે બાજુવાળાને spread કરશે, બીજો, ત્રીજા, third, fourth and fifth. Yes, reinforcement means 5 જણા લડે છે, they are not sufficient, બીજા 5 ને add કરી દઈએ આપણે. That is total of 10. Yes, we are not motivating, we are not increasing the strength of stimuli, we are increasing the number of the fibers. Yes, so that is the difference, irradiation and reinforcement. What is the effect? Maximal resistance may be used to cause irradiation or overflow from stronger patterns to weaker patterns, or from stronger group of muscle within a pattern to weaker group within the same pattern. Pattern, same example. Yes, કોઈ પણ pattern form કેનાથી થશે? મારું shoulder move થાય છે, elbow move થાય છે, wrist move થાય છે, and even the fingers and the thumb is moving. Yes, all the movements are possible. આ pattern છે. આ પેટર્ન માં say for example આપણે જે પેલા એક્ઝામ્પલ લીધેલો કે wrist સારી મૂવમેન્ટ કરે છે, but there is no possible movement at elbow joint. તો શું કરી શકાય? આ જ પેટર્ન માં હું અહીંયા એટલું રેઝિસ્ટન્સ આપીશ, that is shoulder and wrist region માં, કે elbow muscle stimulate થવા મળશે. Yes, and then I can provide resistance. Along with that it will increase. ધીમે ધીમે હું જેમ અહીંયા રેઝિસ્ટન્સ પ્રોવાઈડ કરીશ, ask the patient to do it, and once he is doing this movement, yes, when he is doing this movement, at that time there will be irradiation. એટલું resistance provide કરવાનું કે elbow extension when you are moving up, and elbow flexion, irradiation through contraction મળે biceps and triceps muscle. Yes, so providing resistance to produce irradiation, બંને principle linked છે. And we can move from stronger pattern to weaker pattern. Stronger pattern, yes, if we talk about હમણાં જે આપણે વાત કરી કે shoulder, ખાલી shoulder ઉપર ધ્યાન દઈએ તો first it moves into flexion, abduction, external rotation. તો પહેલા shoulder flexion થવું જોઈએ, shoulder abduction થવું જોઈએ, અને external internal rotation થવું જોઈએ. Yes, so pattern જ નથી patient માં, patient ને આવડતું જ નથી કઈ રીતે કરવું, completely paralyzed patient છે, and you have elbow somewhat power. So તમે શું કરશો? You will try to resist the elbow and produce shoulder flexion. Yes, you will try to move the hand and ask the patient to perform elbow extension in this position, that will produce abduction. Yes, and you will keep the hand in this position. Ask the patient to move the hand in or out or flex the elbow, and slowly and steadily the patient will try to do external and internal rotation. Yes, that is force of irradiation through resistance. ધક્કો મારીને, or you are preventing a motion and after that you are trying to produce a new movement. That is possible. Spread the muscular activity which occurs in specific patterns. એક specific pattern માં muscular activity છે spread થશે. Yes, if you are doing this and if you are providing resistance enough, then of course it will move in this pattern only. તમારે hand placements are also important. One of the principles that we are going to see, where you touch, તમે જ્યાં પણ અડસો patient ને, say for example I am keeping my hand here. Yes, તો અહીંયાથી પણ એમાં sensory input અંદર જાય છે, and the same place I will apply resistance. So when I am moving the hand into extension, તો અહીંયાથી મારી બે fingers એને extension માં resistance આપશે. એ resistance એટલું હોવું જોઈએ કે elbow માં તમારે movement જોઈ છે in such a patient, તો એ resistance through irradiation થાય અને તમને elbow માં extension જોવા મળે. Yes, so as a physical therapist you have to be very strong. Your hand should be like an artist. Yes, you should know where to place your hand and how much resistance you have to provide to that patient. Increasing the amount of resistance will increase the amount and extent of the muscular response. Naturally, જેટલું resistance તમે વધારે provide કરશો એટલો જ વધારે સારો response through irradiation તમને મળશે. Naturally, yes. Working against maximal resistance can produce associated reaction in spastic patient. Associated reaction. ઘણીવાર paralyzed patients હશે, એમાં this side is say for example normal, but when you do excessive movement ને તમે બહુ બધો resistance આપો ને, તો આ હાથ ઉપર કરતા કરતા આ હાથ પણ ઉપર થવા માંડશે. નોર્મલ સાઈડ ફ્લો જવા માંડશે, ન્યુરોન્સ એ બાજુ ફાયર થવા માંડશે. યસ, ધીસ ઇઝ અ નેચરલ ફિનોમિના. નેચરલી આ થશે જ. યસ, ઇવન ઇફ યુ વોન્ટ ટુ try to lift a bed or something on the or with one hand. Yes, try to do it with one hand. Your fist will automatically be made on the opposite hand. Why? Because એ બાજુ પણ સિગ્નલ simultaneously જવા માંડશે. Yes, force એટલો છે. Through nerves, through brain, it is giving so much signals that they cannot pass through just one day. They get diverted to other side. Yes, so that is the same thing. So working against maximal resistance can produce associated reaction in spastic patients. Spasticity, that is hypertonia. જ્યારે muscle tone increase થઈ જાય. Yes, normal muscle tone કરતા વધારે. That is a sign of injury to the brain. Yes, so that is spastic patient. For spastic patient, maximal resistance is defined as the amount of resistance the patient takes without producing associated. જ્યારે પણ તમે spastic patient ને treat કરતા હોય, neurological patients which have hemiplegia, they have impairment in brain. વાંધો ક્યાં છે? brain માં છે. They will not be able to control one side, and because of that there is increase in muscle tone. Yes, so increase in muscle tone છે. The same thing, you will have to provide only as much resistance, એટલું જ resistance provide કરવાનું જેનાથી બીજી બાજુ normal side reactions ના આવે, action યા produce ના થાય, એટલું જ resistance provide કરવાનું. That is optimal resistance for spastic patient. If associated reaction occurs, it means the therapist is applying too much resistance. Yes, so if resistance is way too much, there will be associated reaction. એ નથી થવા દેવાના. If you are making this happen, શું કામ નથી થવા દેવાના? If you are making this happen, spasticity will increase. તમારે શું કરવું છે? હાઇપરટોનિયા છે તો એને ટોન ડિક્રીઝ કરવો છે. That is not possible. Yes, if you provide excessive amount of resistance. So irradiation and reinforcement through the mode of resistance is needed. Okay, example. Resist the muscle activity of the sound limb to produce contraction of the muscles in the immobilized contralateral limb. Say for example, this side is affected and this side is normal. તો જ્યારે પણ હું રેઝિસ્ટન્સ પ્રોવાઈડ કરીશ આ સાઈડ પર affected side, sorry, non affected side ઉપર, at that time it can produce action on the affected side. તો જ્યારે પણ elbow flexion હું આ બાજુ રેઝિસ્ટ કરીશ, જે normal side છે હું રેઝિસ્ટ કરીશ તો left side પર reaction આવશે. Yes, here opposite we are talking about. Associated reaction શું હતા? Associated reaction એટલે કે જે normal side છે એમાં reaction આવે શેનાથી? Providing resistance on the non affected. Yes, here we are talking opposite. Affected side કાઈ નથી કરવાનું, non affected side, this is normal side, ત્યાં હું resistance provide કરું છું elbow flexion માટે અને affected side movement આવવા માટે. Yes, paralyzed હોય patient એટલે કે movement એનાથી થતી નથી, zero, grade 0 of MMT. Yes, grade 0 is no contraction, no flicker contraction also. Contraction is possible નથી, તમે palpate પણ ના કરી શકો, zero. Yes, at that time you want to start the contraction. તો શું કરવાનું? Normal side છે ત્યાં resistance આપવાનું, એટલું resistance આપવાનું, isometric contraction કરાવવાનું, that it will cause action on the affected side. જે side affected છે, paralyzed છે, ત્યાં reaction આવશે. Yes, so that is first example. Second, resist supination of the forearm to facilitate contraction of the external rotators. Yes, so this is pronation, this is supination. So if you resist the supination, એટલું resist કરો તો reinforcement થી ધીમે ધીમે હાથ external rotation માં જશે. Yes, if you keep it in internal rotation and provide resistance, such high amount of resistance, it is called shoulder external rotation. So two examples you need to remember and you need to apply when you see a patient of stroke or hemiplegia or paralysis. Resist hip flexion to cause contraction of the trunk flexor muscle. So right now I am sitting, yes, in high sitting position, I will provide resistance to my hip flexors as much as force, જેટલું પણ force છે as a therapist I will be applying. એનાથી શું થશે? hip flexion માં નથી આવતું તો trunk flexion થવા માંડશે. Yes, so if the patient is not able to sit properly, you will provide resistance as much as possible and slowly and steadily the patient will move forward because trunk flexor muscles will get irradiated. Resist hip flexion with abduction to external rotation to facilitate the ipsilateral dorsiflexion muscle to contract with eversion. This is one of the patterns. So we will see when we are going to see the patterns of lower limb. Resist neck flexion to stimulate trunk and hip flexion. Now say for example I am resisting my neck flexion. તમે પાછળ ઊભા છો and as a therapist you are standing back and you are trying to put the hand on my forehead and you are asking me to contract and simultaneously you are trying to apply the force on my head, producing isometric contraction. એટલું force તમે apply કરો છો કે movement નથી થવા દેતા and then slowly and steadily my trunk will also get engaged. My trunk and the hip flexors, they will start taking action and they will start contracting. Yes, so this is an example of irradiation. Resist neck extension to stimulate opposite. Yes, તમે હાથ પાછળ રાખીને you try moving your neck into the same region slowly and steadily. Neck muscles overcome નથી કરી શકતા એટલે trunk muscle and hip extensors will start acting and they will try to move yourself back. Yes, because the neck is not able to do. Rest dorsiflexion to facilitate contraction of ipsilateral quadriceps. Yes, when you are sitting high sitting માં જ્યારે તમે હોય and you try to move or resist the dorsiflexion તો શું થશે? Hip extension થશે સાથે. Yes, hip extension is caused by quadriceps muscle. Yes, so these are the some few examples that we want to talk. Okay, we'll cover even, okay, we'll keep it for the next time. Next time we'll be able to complete the whole procedure, that is principles. Yeah. Sorry. Okay, so two basic things we discussed: resistance and irradiation and reinforcement. Irradiation, reinforcement are done through resistance only. Resistance वगर reinforcement or irradiation ना થાય. The basic difference is first, irradiation is the spread of signal. Reinforcement is to freshly add a new stimuli. Yes, so these are the two differences. Fine. Any doubts till now? Anyone has? Yes or no? Everyone should reply in the chat. Everyone. Okay, fine. Ayush, have you taken the attendance?
Yes, sir, I have taken.
Okay. Just wait. Don't leave the meeting as of now. Just wait.